I would like to introduce myself. I am Alvin Glassgold, founder of the Glassgold Group for Plastic Surgery. I'm a board-certified facial plastic surgeon, and I specialize in rhinoplasty. Today I will speak about revision rhinoplasty, which is surgery to correct a previously unsuccessful rhinoplasty. Approximately 1/3 of the rhinoplasties I perform will fall in the category of revision rhinoplasty, so that I have extensive experience with this procedure. When meeting with a patient, my goal is to evaluate the complexity of the problem and to decide whether additional surgery is indicated and worthwhile. The problems I see are varied, and sometimes what appears to be simple to a patient may actually be a complex problem. Many patients have had multiple procedures, so in proceeding with surgery, we want to ensure that we can anticipate a high degree of success. The majority of the problems encountered in revision rhinoplasty are related to various types of distortion of the nasal tip. The anatomy of the nasal tip is presented in detail on a video blog called About Your Nose. Suffice to say, the nasal tip is comprised of two cartilaginous arches termed the lower lateral cartilages, as demonstrated in this image. These cartilages vary in shape and thus primarily account for the different appearances of the unoperated nasal tip. In addition, when we refer to the columella, it is the central post separating the nostrils. During rhinoplasty, these cartilages are usually modified to change tip shape and position. In some cases, this modification may produce undesirable results, which can be classified into categories such as overprojection, loss of tip support, and/or definition, and various types of asymmetry, including a pinched nose and sometimes excessive visibility of the nostrils and/or of the columella. Correction of these deformities occur by exposing and reshaping the cartilage structures, which may include rebuilding the tip with cartilage grafts usually taken from the nasal septum. This is completed through an external rhinoplasty approach, which utilizes a small, almost invisible incision on the columella. In the following slides, we are going to examine some examples of postoperative complications or bad results that have been presented to our practice after primary rhinoplasty done elsewhere, as well as the corrected those after revision surgery. The first photograph that we will examine are two examples of what appears to be completely absent tip structure, resulting in what is commonly referred as a polybeak deformity. This is probably one of the most common undesirable results that I encounter after rhinoplasty. It is best demonstrated on the lateral view as shown in this photograph. As you can see, there is an associated excess visibility of the nostril, which is also not an aesthetically desirable result. The postoperative revision rhinoplasty results are shown. In this photo, the postoperative results are underneath the preoperative photos and show a nicely structured tip and less visible nostrils. This is the second patient's postoperative results shown on the right. Tip restructuring in both of these patients involved utilizing septal cartilage to form a new and appropriately shaped tip. I also corrected the excess nostril visibility and slightly reduced the profile. The second type of undesirable result are contour failures resulting in a bulbous tip. As you can see, the tip is rounded and not well defined in these first two patients. This patient demonstrates a significant contour abnormality at the tip. She has a pinched nose and a rounded, ill-defined tip. On side view, we will see that she has a hanging columella, which is an excessive downward projection of the columella This results in a rounding of the inferior portion of the nose and excess nostril visibility. Now we will show the before and after photos of the last 3 patients. The preoperative photo is on the left and the postoperative result after revision is on the right. In this patient, the preoperative photo is to the left and the result after I performed revision surgery is shown on the right. In the third patient, who had a pinched nose, a hanging columella, and visible nostrils, I corrected these problems by reshaping the tip cartilage, utilizing cartilage grafts, and removing some of the redundant scar tissue in the tip, thus producing a more normal and pleasant tip structure in relation to the rest of the nose. In the third category are cases in which the supporting structure of the tip has been lost. So the tip drooped. It is now below the normal profile line, resulting in an underprojected tip and an unpleasant profile. On the right, we can see the results after revision surgery utilizing septal cartilage to augment and refine the nasal tip. These final photographs demonstrate a poor result due to overprojection. The first example is a patient who requested a revision rhinoplasty due to an overprojected nasal tip from an original surgery done elsewhere. What I mean by overprojection is that the nasal tip is too far out from the face. You best see this on a lateral or side view. In addition, you may also notice that her nose appears pinched at the tip, which is best appreciated in the frontal view. The second patient also dissatisfied. Her original rhinoplasty resulted in a severe distortion of the nasal tip associated with overprojection of the tip. The results of revision surgery are shown in the photographs on the right. They are just a few examples of the many problems we encounter and correct. Correction of these deformities was performed with an external rhinoplasty approach, as previously described, and produced a significantly more normal appearing tip, as well as improved aesthetic balance between the tip and the remainder of the nose. In my career, I have personally performed over 7,000 rhinoplasties. A significant number of these are revisions. From this extensive experience, I have realized the challenges and technical difficulties in converting a bad result into a very good result. If you are considering rhinoplasty, or especially revision rhinoplasty, I recommend that you seek a board-certified facial plastic surgeon who focuses on rhinoplasty and who has extensive experience in revision rhinoplasty. It is important that you feel comfortable with the surgeon and that at consultation he can answer all your questions and that he is able to demonstrate his expertise in revision rhinoplasty with appropriate before and after photographs such as I have shown. For more information, please visit our website at www.glassdoorgroup.com. Thank you for your attention.